Hey, I'm Shrenik Jain, and I'm one of the founders of Beacon, and we're working on applying natural language processing to mental health. Institutions, we notice on a larger scale, like take for example the VA, they spend $7 billion a year, and rising quickly, on therapists. They're literally throwing money at the problem because they're losing over 20 veterans a day to suicide and a host of other issues, right? But the problem is because these institutions are kind of structurally flawed in how they approach this problem, because they keep spending money on therapists, right? Because therapy is shown to be clinically effective. But that's not actually having much effect in reaching their populations because, for one, they're highly stigmatized, right? So more veterans that died by suicide last year were not receiving any form of therapy. So the majority of veterans who actually took their own lives weren't actually using the services that we're spending billions of dollars on, right? So that's like a completely unsound way to approach things. So it doesn't matter how many therapists you have. And then the second thing was because so few people are actually seeking care for these conditions, the current infrastructure that we spent so much money in building, it's only really built to treat a very small fraction of the people that actually seek care. So if we got what we wanted and we reduced the stigma around mental health and everybody who needed help tried to get help, there's no way that our current standard of just one-on-one therapy would actually work, right? They would overwhelm the infrastructure in days. So we realized that there needed to be this kind of way to make things more cost-effective for the institutions that are paying for these providers, while at the same time making things more accessible for patients to deal with issues like stigma and a distrust of therapists and all of that. So that's when I came to Hopkins and I met my co-founder Ravi, who had similar thoughts in this space. He had watched a very close friend suffer through isolation basically between therapy sessions. And at the time he had the idea for just like a basic chat app. And then since we both studied computer science, we realized that you could use natural language processing here to really make things more scalable. So we basically got together and we built out this platform for anonymous group-based text therapy, right? Text and voice therapy. Because the idea was that if you make the platform anonymous, people can reach out under a pseudonym, kind of like a screen name that you would see on Reddit, and then they wouldn't feel judged for sharing their issues. And the other component is by giving them this peer dynamic, this constant community, you really, A, make things more scalable for the provider because you're adopting this group model of support, but B, you give people access to others who they can always empathize with. So in certain demographics, say veterans, say the military, firefighters, it's a very tight-knit group. And oftentimes when these people go to reach out for support, they feel alienated because the therapist doesn't relate to them. So this way we could combine sort of the clinical efficacy of therapy with the persistence that you see in peer support. And then we use natural language processing to basically make the whole thing scalable. So we use natural language processing, for example, to automatically detect suicidal or malicious intent that takes place within these groups. We can also use these same algorithms to track how the group's overall sentiment, whether it's positive or negative, is going over time. So we can see, if individual users are getting better or worse over, a month-long period. And that's something that really hasn't been approached before in behavioral health, because right now the average person drops out of therapy in like less than 3 sessions. So there's a total lack of tracking and quantitative data, and any of that. So it was our idea to use technology to track these people, make moderating the groups more efficient, because now the therapists can sort of focus their time and energy on the users most in need of help when they need help, and do that all through a mobile platform so that the users could reach out to help easily from the privacy of their phones.